Hello, it's Dr. Kieran, and let's listen to some real-life examples of what croup sounds like in babies and children. But before we get there, let's cover what croup is, what the symptoms are, and what the management is. Croup is a very common childhood illness that is normally caused by viruses such as RSV, parainfluenza, and adenovirus. It commonly affects children between the ages of 1 and 3, and some children may have croup multiple times in childhood. Croup causes swelling to the voice box, windpipe, and lungs, which produces a characteristic cough and breathing problems that are associated with croup. Now let's cover what the symptoms are. The most common symptoms of croup in children include a harsh barking cough, which is often described as seal-like. This happens because of inflammation of the vocal cords in the voice box, also known as the larynx. Stridor. This is a harsh breathing sound that is commonly heard when the child breathes in and is due to inflammation of the windpipe and the voice box. Other symptoms of croup include a runny nose, sore throat, or preceding viral illness with cold-like symptoms. Sometimes croup can happen without any of these things prior to it. Now, remember, the symptoms of croup are worse at night. They usually last for about 1 to 3 days before getting better, but the cough can linger on for a few weeks. Now, let's have a listen to what croup sounds like in real children. So how can you help your child with croup? Well, if your child has any breathing difficulties or you think they have croup, it's important you see a doctor who can assess them and prescribe a small steroid medication such as dexamethasone or prednisolone if necessary. Here are some other tips that can help your child. Stay calm and reassure them. This is because children who get distressed or begin to cry can make the symptoms of croup worse. Sit your child upright on your lap and support them through any noisy breathing. Encourage your child to drink drinks little and often to help with the sore throat and keep them hydrated. And finally, give them ibuprofen or paracetamol to help with the pain of the sore throat and relieve any fever that can sometimes occur with croup. Remember, if you are very worried about your child or they have lots of problems with breathing, they are unlike themselves, they are drowsy, or you really are very worried, it's important you take them to somewhere like A&E where they can be assessed and they may need other medications such as steroids or nebulized adrenaline, as well as some oxygen to support them. Thank you for watching this video, and I hope you found the real life examples of croup useful. Remember to give it a thumbs up, comment if you have any questions, I will respond, and finally, please share this with friends and family so they are all aware of what croup sounds like and what to look out for.